It keeps them alive to get them another chance. This is a new day. Just being excited about opiates, being excited about gun safety, and building a team, we have made a big difference. Conversations with them about the reason I got involved with it, again, I think is a little bit selfish. It was affecting my day-to-day work. I really felt like I was fighting with patients about opiate prescriptions. And I just was not having a great conversation with people about why I didn't want to write them opiates. A few years ago, I heard about this recovery coach program. People with lived experiences with substance use who have gone through training to talk to people about getting them help. They're on call for us in the ER now. We are partnered with Wiz Hope. It's a beautiful relationship where they say, where are you right now? Where do you want to be? What do you see your life as being? And how can we help you with that? I love that. And that conversation, taking the time and coming from the same place, we make a lot of inroads to help people get help. I really wanted to get that program running before we gave out Narcan, because I really felt like just throwing Narcan at people was kind of a Band-Aid. But once we got the recovery coach program going, we could say, okay, and in addition to this, here's some Narcan. If you get into trouble or somebody around you gets into trouble, you can be revived. That's the naloxone program, which I'm really, really excited about. We were the first emergency department, I think in Wisconsin, but I know at least in Milwaukee that gave out free Narcan, and it's been wonderful. It makes us as providers and our team feel like we're doing a little something.
Are you 3 to 11 or what's your shift?
I'm 3 to 11.
Nice.
I love the patients. It is so much fun to work in an environment where you're meeting somebody new every 5 minutes. Each person you meet is a little puzzle. What's going on? What brings you in today? What can I do to help them? It has been all of our privilege to work during COVID. It has been historic to live through this pandemic that none of us working have worked through a pandemic like this before. One of the big things about COVID is that, especially early on, we were the only people that were allowed to be with them during their deaths. We were their family at the end. That was extremely powerful for the entire team. Because of where we are and because of the gun violence in Milwaukee, this is the room, we get a lot of drop-off gunshot wounds here. So this is the room we try to keep open for our trauma room so we can bring people right in here and do things quickly for them. If you approach the desk and say, hey, I've got a gun in my home, can I have a gun lock? You can get a gun lock. That was a program started by one of our nurses a couple years ago, which is fabulous.